So we're here with Shaun Weiss. He's the founder and co-founder of Beyond Med, and Beyond Med is a company, and Shaun will tell you all about it here in just a second. But he, they've come up with something that's really interesting that we believe can help you when you're recruiting new physicians and getting them onboarded and getting them set up really to hit capacity as fast as possible, right? So we spend 2 months, 18 months, 36 months, and countless dollars to try to recruit that great new physician to join the group that we're recruiting for. And so now, once that happens, obviously as physician recruiters, we generally hand it off to onboarding and credentialing and the practice managers. But wouldn't it be great if you could also make an introduction to somebody like Shaun and his company that goes out and has a very innovative way of helping promote that new physician or existing physicians that need a little extra, patience, and or if they want to change the mix of their patients from what they have to a little bit more self-pay at a little bit higher margins. That's where Shaun and his team comes in. So recruiting and onboarding and getting doctors up to capacity, or keep getting existing physicians, and your providers up to capacity by adding MedCV, as an option to your physicians, I think is really powerful. And it's kind of a new way. You're not having to recruit and market this new physician all by yourself anymore. There are partners like Shaun, and he'll tell you about it here. So now Shaun is also, he happens to be a lawyer as well. And I know a lot of lawyers, but he's the nicest, honest lawyer I've ever met. And he doesn't practice law that I know of, right, Shaun?
That's because, I was gonna say it's because I'm an ex-lawyer now.
Right. So Shaun went to Georgetown, so he's got some bona fides there to go with this, right? And then you spent some time in the M&A, mergers and acquisitions, private equity side, and then you decided with your brother to start this. And your brother's still on the M&A side, right? And your mom is a emergency room physician, and your dad is a dentist. So he's been exposed to the healthcare space his whole life, and that's why his teeth are so great, and he's probably healthy too. So, and Shaun, so I really want to, tell me a little bit about Shaun and you moved down from New York, and you got married and all that. So you're living the life of a young entrepreneur.
Yeah.
Great family that you're building and everything, right? So
yeah, super lucky. Originally from South Florida, was from like West Broward County, and then got to kind of go off and live in a bunch of different places, and moved down here around the same time as my brother 3.5 years ago, back down to South Florida in order to start this company, and have been very lucky with it so far, and meeting great people. I was the one who, for one, very, very happy to get back down to South Florida. I was tired of the cold on a personal note. And I was saying before we were talking before we moved down here, immediately got the dog, got the house. I can finally grill a little bit in my backyard, which I've been dying to do for years. And along the way, stumbled upon this really great idea in which we could go ahead and kind of change the way healthcare recruitment was going, and how providers were building their practices as well. And that's how we found Beyond Med.
Yeah. Well, so when you're in the M&A space, were you doing things in the insurance side? And that's where this kind of started cultivating your idea and nurturing your idea into something. There's a missing piece of this that we can do something about.
Yeah, totally. It was definitely a part of it. In the M&A space, I did quite a bit in health insurance. That was sort of one of my main sectors. And originally, when we were thinking about it, from the member side and the patient side. There's a lot of frustration with health insurance right now, whether you're a patient or whether you're a doctor. And it seems as though there's this giant multi-trillion-dollar wedge that's sitting in between. Because since the beginning of time, medicine was between a doctor and a patient, and now we've got this enormous monster right in between. And we figured, well, why don't we go ahead and create another more so easier way in which to connect doctors and patients who want to utilize those services. And we began the concept by concentrating on things that fell outside of health insurance, things that were elective and voluntary, things like fertility and bariatrics and plastics and dermatology, down to acupuncture, chiro, PT, mental health, and then some of the aesthetics as well, and more so holistic wellness.
Yeah, and right now you're 3 years old, right? The company's 3 years old, but you have a network. Tell me about the network now, and what markets you're in,
Totally.
and then also touch on the employer side and the employee benefits, and how how you're getting in that space and directing patients to providers.
Yeah. So right now we're in Florida, New York, Arizona, and building New Jersey and Connecticut. But that doesn't mean that's all we're focused in. That's just where our primary area is in. So we're actively bringing on provider chains and hospital chains that span the nation. That's where we're selling to right now in those 5 areas. Right now we have about 3,000 providers and counting, and growing quite quick. We build our own network organically. It started with us knocking on doors, and then did so myself at the very beginning, and got to understand how providers were building their practices, and how hospital administration works. And we go ahead and we create this network, and we sell it as a health benefit to employers, either private sector or public sector, where members can go ahead and buy into the network, where providers are giving some reduction in relief in rate. And I'll explain how we get to that in a little bit. And members sign up because they want to go ahead and utilize those services, and they sign up for us when they're signing up with their health insurance.
Yeah, so you individuals can sign up irrespective of employment or not, right?
Yep.
And then, but you also go to the employers to say, as part of this package, if you do this, these kinds of services are available that are not covered by your current plan.
Yeah.
And your employees will save money. So it's one thing about the saving of the money, but also what about like infertility is not about saving money necessarily. It's about having a baby, and it's different. And they've had to go to extreme measures to make sure that they are able to create that family, right? Mm-hmm. So it's not a money issue there, but it is nice to save some money. But what does that do to employee retention?
Yeah. So benefits right now is one of the biggest things that employers are doing to show their employees that they care. And health insurance, if you've ever dealt with it before, it all feels very stale. It all looks the same, it feels the same, and it creates the same frustration points. We wanted to create a benefit that where day one, the people who signed up for it could go ahead and save. And they would know that because the things that I named before are things that are elective in nature, whereas they're things that people want to do. They want to have a baby. They want to go ahead and seek mental health. They want to go help. They want to go ahead and engage in bariatrics or cosmetics. So they know day one that they were going to go ahead and utilize these services. And we're able to find and place providers as a match system, in a sense, that will go ahead and take these patients who are paying completely out of pocket. There's no claims associated with this. There's no administration. And in turn for that, since there's no marketing for the patient, there's no claims admin on the side, there was room left over within the provider fees that they could go ahead and offer some relief.
Right. Well, so also, since you're out there talking to the employer mm-hmm. and helping their employees with this benefit, what do you do? Tell me how you'd promote, say, a hospital and a health system that's a partner in that market.
Totally.
Right. I mean, to make sure that they understand that that's where that care can come from, and they're partners in this, and they get it, and they understand, and they're great to work with, and you'll get the best care anywhere.
Yeah. I mean, at the end of the day, our business is promoting providers, and making patients aware that they are there. Oftentimes what happens is that someone has something they need to do, they quickly seek care, they go on Google and they search whatever's close to them and they run to that doctor. Whether that doctor is good or not, they're reading some sort of Google review or secondhand discussion with a friend, and then they're hop around from one provider to the next while they're discussing fees and rates and all the issues, and then months and months go by, and then they finally find somewhere to have service. What we wanted to go ahead and do is create a network of providers that we felt had very high standards and had a value to offer the members in returns for some of these rates. And how we go ahead and promote them is in a few ways. We're always in contact with our members. We're promoting our partners through hospitals and just general provider offices through the mobile app, through our member app, constantly through our member newsletter, our concierge service, and to open enrollments.
Social media, right?
And social media, yeah. And we're bringing in, as we were talking about before, we're bringing in providers. So we offer our benefit to members when they're picking their service, their benefits at their annual open enrollment fairs. We bring providers in with us so that patients not only say, oh, Beyond Med, but they say, oh, Beyond Med and X hospital or X provider facility is with Beyond Med. That way you have the ability to freely market yourself and talk to patients who might be interested in your services in an informal and easy environment.
Yeah, so you could also, you'd be open to inviting hospital hospital services personnel, as an example, right? To talk on behalf of the medical group or the hospital services that they offer as well.
Completely, yeah. We do that not only at the member level, but at the employer level too. When employers are specifically looking, because employers want the best for their employees, and they're looking, oh, well, what facilities will be available for my employees? That's oftentimes when we'll bring a hospital system in and say, hey, we've got this great deal with this hospital system and I'm not talking about 1, 2, 3 employees. I'm talking about large volume of employees that might work for a large company or public sector, city, municipality, and say, hey, we've created this relationship where this can be your go-to hospital.
Yeah. Well, very good. And I know that obviously we're also helping, as those of you who are watching this, if you're a KontactIntelligence client, you're using our our ATS generally, and maybe some of the other services that we offer for the healthcare space. And if you know me or know us, then you also know that the reason that we have the MedCV logo in the background there is because of the network of a couple 100,000 physicians who are using the MedCV network. And so for us, we're also promoting the opportunity to the individual network providers that are members, not just the hospitals themselves. So with any luck, we get more providers who grow the markets. And did you already talk about what states you're currently in? And if you're not in, like if you're watching this and you're in a state that you don't hear and you're a hospital health system, call Shaun, because they will network, right?
So it's funny you mentioned that. So we're right now we're selling our product into Florida, New York, Arizona, Connecticut, New Jersey.
And you also accredited insurance, registered with, right?
Yeah. So for instance, in Florida, we're with the Office of Insurance Regulation. We're a regulated entity. But to your point, if you're not in one of those, if you're in one of those states, great. We have members coming in now. But if you're not in one of those states, the opportunity is actually even better, because what we go ahead and do is we give geographic and sort of exclusivity based on timing. So you can be the first ones to go ahead and get members into your door as we're going ahead and growing out. We go ahead and we create what's called heat maps. So that will say, okay, we can have X amount of plastic surgeons in a zip code, X amount of fertility providers in a zip code, X amount of bariatrics. And then we hold those levels until member volume becomes very big. And then we increase those levels as member volume becomes big, because our value proposition to you is we want to create real impactful patient inflow. So the sooner you get in, for instance, when we opened Arizona, we had providers who were calling us because they wanted to be the first in line to go ahead and receive those new pipelines of patients. And that went beautifully.
Right.
And there's no cost to being on the network and sitting there and waiting. You basically get to hold your spot for free.
Yeah, and I can't overemphasize the uniqueness of this as it relates to marketing to patients, right? I mean, as a hospital, we normally would have introduce a new physician in town, right? And we do a press release, we'll do some social media, we'll do a little television, introduction or something, and then add some things on the website, and then let the referring network know that there's a new provider, and then do some patient-esque advertising, right? General hospital patient things, or medical group patient advertising in the paper. And I don't know how many people actually read the paper anymore, but that way. But what you're really doing is you have a vested interest. You have skin in the game to go out and get patients, right? So if you come on board and there aren't any patients that are in that network yet, because you're in that new location, for instance, that they hadn't been in the past, Shaun and the team are going to go out as fast as possible to communicate and engage with all the employers, large or small. Start probably with the large employers in the area, right? And also directly to patients, because they want to drive patients to your facility, right?
Yeah,
that's a marketing strategy that doesn't cost you anything. It's part of the price, right?
Yeah, we don't make any money off of our providers. We want any money that would have ever been paid to us to be deferred to the patient, because that way the patient is receiving a savings. They are happier, the provider's happier with happy patients that are coming in an inflow. And exactly as you said it, we are incentivized as soon as a network gets up and running, or as we're building it, to start immediately getting patients knowledgeable about those hospitals and provider offices. It's in our best interest. It's our only interest.
Well, and also the patients could pay directly, but also when you go into an employer, they oftentimes will just say, well, here's a package for my 300 employees that you'll offer, right? And the employer pays for that service as part of the benefits package, right? And retention and all those things. So, yeah. Hey, thanks, Shaun, for telling me a little bit about the why and those kinds of things and what you guys do. Bottom line is that when we recruit new physicians, we need to get them up to speed as fast as possible. And this is a resource that makes sense to me to explore, to get as many patients as possible, as fast as possible, that are self-pay with higher margins into your practice in those categories that are typically self-pay. And then there's also probably a very powerful value proposition to go in and say, well, maybe I went in for infertility, right? And I came to your hospital because of that, because of the introduction through Beyond Med. But it also could be that I'm going to select my new primary care physician too. And I'm going to select the primary care physician for my mother or my daughter or my son or whatever. So all those components come with this for you to have an opportunity to explore, which is just a byproduct of signing up and doing something with Shaun and his team, right?
Yeah, absolutely.
And doesn't cost any extra for that either.
Costs nothing.
It's about nurturing and cultivating relationships of those patients so they all come to you.
Yeah, we want to create long-lasting relationships between the patient and the provider.
Right. All right. Well, Shaun, thanks a lot. I think people will find this useful in watching this little video to tell people why, and also a little bit about, the cool factor of what you guys are doing as young entrepreneurs. And you've survived the first year, so you're well underway, and you'll be around for a long time to come, and coming to a neighborhood near you. And if it's your neighborhood and they're not there yet, just call them, and they will be in your neighborhood.
We will be.
Yeah.
Thank you, Niels.
Thanks a lot.